Good morning, everyone. Allow me to introduce myself and my partner. My name is Teresa Putri Wijaya, and my partner is Muhammad Rafi Bintang Ramadan. We are from the first group. In this presentation, we will discuss about pharmacy. From an article, the title of the article is The State of World Pharmacy, a portrait of the pharmacy profession. Well, let's start this presentation. There are 4 topics in this presentation. The first 2 topics will be presented by myself, and the last 2 topics will be presented by my partner. Introduction. Pharmacy is the health profession concerned with therapeutic medicine. According to the 1968 Medicine Act, the therapeutic substance is any substance or article administered to human beings or animal for a medicinal purpose. The function of the pharmacy. The focus of attention is now normally on the pharmaceutical needs of the patient rather than the preparation of an elegant product. These patient-focused activities have evolved into the concept of pharmaceutical care, which has been defined as the responsible provision of drug therapy to achieve definite outcomes that improve a patient's quality of life. Pharmaceutical care involves pharmacists being directly accountable to patients for the outcomes of drug therapies. The pharmacist has shifted from a focus on the preparation and supply of medicine to a focus on the sharing of pharmaceutical expertise and knowledge with doctor, nurse, and patient. The education of the pharmacist. In recent years, the period of study has extended to become longer, and the competencies required for registration have become more rigorous. In the UK, there are currently 16 schools of pharmacy. This over a 4 years undergraduate degree course leading to the Master of Pharmacy degree. The registration year is now highly structured, and at the end of it, candidates sit a pre-registration examination. In the USA, a professional doctorate qualification, the PharmD program has become the norm. In the institutional setting, this is known as a residency program, usually a one-year program of formal education and training in all aspects of pharmacy practice.
The third topic is about the regulation of pharmacy. Although there remain considerable discrepancies between the educational attainment of pharmacists in different countries, there is increasing mobility of pharmacists between them. There are, for example, mobility agreements between the countries of the European Union, subject to competence in the relevant language. However, the actual number of pharmacists who have taken advantage of this facility is so far low. Pharmacists who have qualified in other countries can apply for registration with the RPSGB. For example, in order to work in the UK, less than 1 in 3 developing countries has fully functioning drug regulatory authorities, and between 10 and 20% of sampled drugs fail quality control tests. The last topic is about the international context of pharmacy. WHO has played an important part in promoting and supporting the role of pharmacists in improving health worldwide. Indeed, the important contribution which pharmacists can make to effective healthcare has long been recognized at the international level. Assembly held in Geneva in 1994, WHO called on pharmacists throughout the world to support its drug strategy. It urged governments to more clearly define the role of pharmacists and to make full use of their skills in national drug strategies. WHO has also played an important part in emphasizing the importance of pharmacy education, ensuring that it is designed to equip pharmacists for their future roles in both hospital and community settings. In practice, pharmacy internationally is characterized by diversity and variability. In carrying out the duties outlined by WHO, countries are hampered by limited access to the services of pharmacists. There are enormous disparities between the numbers of pharmacists per 100,000 population in developed versus developing countries. Before we end this presentation, I would like to give a conclusion regarding the topic of our presentation today. Pharmacists are society's experts on medicine. This paper has described some of the many medicines-related activities with which pharmacists are involved. It has highlighted some of the areas of divergence of pharmacy education and practice around the world. It has also demonstrated the increasing convergence of pharmacy practice, education, and training around the rational use of drugs, medicines management, and pharmaceutical care. Change and varies from country to country. In some, they act as gatekeepers to primary care. In others, they are increasingly taking on roles previously undertaken by general medical practitioners. That's it for our presentation today. Thank you for watching. If you have any question, feel free to contact the number on the slide. Assalamualaikum warahmatullahi wabarakatuh.